And it was foggy enough that the helicopters weren't flying?
Correct. And the policy is that they don't tell the helicopter pilots what type of transport is coming, because they would risk their lives to take anybody, you know. So they pretty much don't tell them what the case is, just tell them where they need to fly and if conditions are favorable, and they said no.
So you're still at the hospital, they're trying to figure out where to take your daughter, and your husband does come in by land transport?
Yes.
All right. So tell me, continue with the story.
Okay. Go back, I go to his room and check on him, and he's telling me over and over again, you know, how is she, what is she doing, how is she, and quite in, I wouldn't say incoherent, but very upset, and, you know, tears rolling out of his eyes. And then he rolled towards me to talk to me a little bit. His neck was in a C collar, but you know, an average one, because he was able to talk and verbalize injuries and things. But he turned over to me, and all I remember seeing is that the skin fell away, his ear actually laid back, and his neck was open, and it was all, you know, like a nice laceration from his ear, and his ear was just laying open. It was the strangest thing I'd ever seen, and I kind of was like, you know, just mortified by it. And I had said, "Are you okay? Does that hurt you?" And he said, "No." He says, and all he was rambling on and on about Maria, and what are we going to do, and how is she, and then I told him I'd be right back. I had to find out what the pediatric ER physician had found out, and she had said that UW Madison is willing to take her, and they need to leave now. The ambulance needs to leave now. And I went back to his room and I said, "Do you want to see her? This might be the last time you get to see her." And he said, "No, it'll waste too much time. She needs to get attention immediately." And that was the last I saw of him for quite a while.
Now, you said that he was having, you know, a lot of anxiety, a lot of emotions, not really noticing what should have been painful. Did he keep repeating the same questions? Did he seem to ask you a question and then have to ask it again, the same question a minute later?
It was like he wasn't listening to anything, or what I was saying was not registering with him. So yes, it was repeated questioning, and that happened for quite a while, even with phone calls later on. It was